thank you for coming. Thank you for being with us and to accept to be in this panel. This is a panel, in continuation of the last one about patient advocacy. And for all of you, I ask what personal experience and motivations led each panelist to advocate for this disease. And this is a very tough roundtable with only 30 minutes. So I ask you to be precise, and I give you for each question 2 minutes, okay? And maybe Monica.
Goodness me, thank you for having me. 32 years of experience in 2 minutes. Okay, let's go. Pardon my notes, I blame my brain fog. What is my motivation? I was diagnosed 32 years ago. I was very lucky. I was halfway through a master's degree, and the university I was at had an excellent medical school, so I was immediately diagnosed. Unfortunately, I wasn't well advised, not through gaslighting, but because 32 years ago, we didn't know. I had access straight away to the database of the medical school. I'm not a medical student. And so for 32 years, I've been studying this disease and living it in person. And I'm very passionate about this. We are 55 million plus patients worldwide. 85% are still not diagnosed. And basically, if you imagine one day someone comes up to you and says, your life as you know it is over. Your job, your mortgage, your savings, your marriage maybe, who knows. And prize, bonus, everybody's going to treat you like you're a nutcase. And I went from calling this chronic fatigue syndrome to calling it be positive and have you tried syndrome, because everybody had a suggestion. And on top of it, you will not get very much medical support, and the state will most certainly not help you. It doesn't have to be like this. My lessons over 32 years, I would like to share them. It really doesn't have to be like this. Had I been advised differently, my life could be different today. I have a very good friend who was diagnosed exactly the same year as me. Today, she is the director of an international school in Bogota. Why? She was well advised. She had an excellent doctor, a pediatrician, she was very young at the time, who said, stop, pacing. You have got to stop. There is a theory that there is a metabolic issue. The mitochondria does not metabolize oxygen properly. I'm not a doctor, forgive me, this is my interpretation, but if you stop straight away, you have a much greater chance of recovering. I was halfway through a very expensive master's degree. I had a thesis to hand in. I couldn't stop. But I was told, don't stop, keep going. We're not sure it's not psychological. So I went. And it doesn't have to be like this. You know, there are ways of dealing with this illness, in dealing with doctors. I have today, 32 years later, fantastic doctors. Dealing with your family, dealing with your friends. A typical phrase that I've had is, people say, oh, you're sick, okay, well, are you going to get better? Well, I'm not sure. And people say, well, you either get better or you die, but you're kind of in between, we're not quite sure what to do with you because, and it doesn't have to be like this. And I'm very passionate about sharing my positive experiences. And I would really like to use this experience to help other people in whichever way I can. So forgive me if I've gone over 2 minutes.
Okay. A little bit more, but okay. Sonya, what are your personal experience and motivations?
Thank you very much. I'm sorry I can't be there with you in person. So all my career I've worked with people who have faced inequity and disadvantage. working with children and families. And I took this job because I wanted to be a chief exec. But then I found I had friends who had ME and I just didn't know. I went to my first interview and I met the team and I heard the stories of the people that they're working with. And I went away thinking, I really want this job. How could I have not known about this whole community of people as a social worker and third sector leader, where people have been left invisible without support? And so I was delighted when I had my second interview and then I got offered the job. And my first year, I worked very passionately, incredible hours to try and affect change for a community that had just been ignored. And then I'm quite ashamed to say, it never occurred to me that anything could happen to me or one of my family members. My son had just had his 11th birthday. He got a chest infection. He had 3 lots of antibiotics. He didn't get better and was subsequently diagnosed with ME. And 10 years later, he's still suffering with it. So my motivation is because people deserve services. They deserve treatments, deserve the research. I deserve that for my son. My son deserves it. And I'm still here because I believe that we can be stronger together and there's still much more for us to do.
Thank you. And Cian,
Sean.
what is your experience?
Okay. So my motivation, I think, is twofold. I have ME myself. I was diagnosed about 11 years ago. Spent about 5 of those years severely ill. I lived through the kind of years of being housebound, at times bedbound, through the extreme isolation that comes with that, and through the loss of many kind of friends, of parts of my family, of others, through the lack of understanding and awareness. But for me, I think a lot of my drive comes from the themes that Monica and Sonya have already mentioned, from the injustice that is part and parcel of what people with ME experience and what people with long COVID are now experiencing too. And the fact that this isn't a medical mystery alone. It is a disease that has been stigmatized and that continues to be mistreated across the world. And so for me, the drive there is about creating change for a group of people that have for too long been badly treated. And I think I really agree with Monica that there are better ways to do this. We have those ways now. To some extent, we don't have as much as we need, but we do have better ways to do this. We can affect change now. And so for me, that's why it's really important to work in this kind of policy advocacy space, as well as the incredible research that we've heard today, that those two things need to be woven together to create change as fast as we can for what is ultimately also a very warm and loving community that I have had a huge deal of support from.
Thank you. And for you, Mona?
For me, it has been a path that hasn't been so clear, maybe as some of you, because it has started with chronic fatigue that kind of developed into more chronic tiredness or fatigue, chronic pain into chronic fatigue. And but that also then with my sister having similar symptoms and my own experience with disability as our family have allowed me to develop a more accepting perspective with the time, but also kind of not giving up totally on wanting to understand this better and find better ways to handle it personally. But then also, I think together with having a mom that has always been very active socially as a social worker, but as well in her life, always fighting for other people individually, has brought me some ideas of fairness and justice, and also awareness of the difficulties that society imposes to those who feel some limitations. So my own engagement, I think, has come quite recently, more in this pandemic situation where maybe some of us have had time to slow down a little bit and rethink our lives. And I have decided to go into the a healthcare profession. So that's why I'm studying now medicine. And Emmy has been with me for a while, but I've only had the diagnosis more recently. And now I've decided also to get my hands on this.
Thank you. The second question is also for all of you. I don't know what is this. What form has your ME advocacy taken? And I initiate for Cian, okay?
Okay. So for me, at the moment, I'm working with the World ME Alliance as their head of advocacy and communications. And we're an organization that now has 27 national member charities or organizations across the world in 20 countries. And we are working together to try and affect policy change through supporting each other as kind of grassroots organizations. All of our member organizations have people with ME or lived experience somewhere at the heart of what they do. And we've got this kind of two-pronged approach, which is, building up the grassroots, sharing the knowledge that we can, sharing the resources that we can, so that we're not reinventing the wheel in different countries across the world. And I think it's really important to say that the stories that we are hearing here today, they are true in every country in this world. This is not a disease that only affects Western countries or white people, as it's sometimes seen in kind of media representations. It affects absolutely everyone. So we've got this, first approach of really trying to build up the grassroots and charitable work that we can across the world. And then we're also trying to focus our work on the World Health Organization to try and create top-down change too. That is going to be a long game. It's going to take us a hell of a long time to get somewhere there. But I think what we're seeing is that the long COVID has really changed some of the attitudes and approaches for executives at the World Health Organization. And we're hopeful that we can work with the World Health Organization directly, but also member states of the World Health Organization, which is all the countries that we are living in, to try and show that we can provide resources from the top down as well that will meet in the middle to create that accelerated change that is really necessary for this population.
Thank you. And for you, Sonya, what is the shape of your form of advocacy?
So I helped co-found and set up the World ME Alliance, and I co-chair that still today. So I work very closely with Sian and our members in the way that Sian has described. At a national level, Action for ME engages in lots of different ways. We have a programme of work with MPs, parliamentarians, to engage them, help them understand the illness better, to ask questions in Parliament. We have signed up some parliamentarians to be champions for us, and a good example was last week before, one of them identified himself as a parliamentary champion for Action for ME, and then talked about the impact of ME and the needs of people with ME when talking about welfare benefits. We've worked heavily with the government on the National Delivery Plan. A draft came out a while ago. We're waiting for the plan itself to be launched. And a lot of this work is being done in the background. And as one of your guests said earlier on, it's very important we do that in a very collaborative way. In terms of research, we helped set up the Research Collaborative in the UK. And through that work, we've engaged with funders and with others. We've secured funding for Decode ME, the world's largest ME study, and we're looking at genetics, and we co-lead that. And we're also involved in another study, genetic study, looking at ME and long COVID with some other partners. And then lastly, we fund research as well, and have also set up a genetic centre of excellence working with the University of Edinburgh.
Thank you, Sonya. And for you, Mona?
So I've joined MIOS recently, and I am hoping that together we can leverage some of the group's knowledge that has been for 20 years working mainly on fibromyalgia, although ME's TFS has been also a strong point from the beginning. But now using this traction from long COVID and the opportunity to have been involved with organizing this conference, I'm really hoping that we can also balance a little bit our representation of both diseases, our way of helping to educate the public in general, but also the medical community or healthcare providers, as well as the patients themselves.
Thank you. And at last, Monica.
My involvement as a patient advocate has been more, it hasn't taken on an official form like Sean and Muna and Sonya. Unfortunately, it was not possible for several reasons. I'm now affiliated with Aliança Millions Missing, but I guess my advocacy has been on an ad hoc basis, talking to doctors, talking to nurses, even pharmacists. One pharmacist I talk to on a regular basis to get medication. She wants to learn more about it. Social workers, crisis support lines. There are people calling them every day, not knowing what's wrong with them. I interviewed someone recently at a crisis support line, and she said a lot of people are showing similar symptoms. They need training. And so I hope in about a year's time to dedicate my time to this patient advocacy, which so far I haven't been able to do full-time, but I very much hope to do.
Thank you. And now I have individual questions for each of you. So Sonya, how do you best support people with ME now and build real change simultaneously?
So I think there are a range of things. I think it's really important as far as we can to ensure services are available for people with ME, that they're inclusive, they meet the needs. And as the charity, we try and plug some of those gaps by providing information support and healthcare. And it's important that where there are services, and I know not all countries do have services, but it's important that we expand them as much as possible. But there are simple things that doctors and others can do to help reduce stigma. It's important to raise awareness to ensure increased public understanding of ME through our press and our media. And as a charity, we do a lot of work in that area. Professional education is important. It's just mentioned about social workers and doctors, but also those in education and other industries. It's important that we have research funding. Research funding will be transformational for people with ME. We need to accelerate research. It's very disproportionate, the amount of money that goes into ME compared with other illnesses, let alone the quality of life or poor quality of life that people with ME have to live with. I've mentioned the policy and advocacy work with decision makers and also support with people to help self-advocacy, although we've got to recognise that there are still severe limitations for some individuals who don't have the energy to be able to follow that through. I think the other thing is working collaboratively, and that's the whole ethos of the work we do at Action for ME and also the World ME Alliance. That maximises the effort, it creates a more powerful, consistent voice, and we can, together, we're a harder voice to ignore. So I think by combining those approaches, we provide immediate support to people with ME to meet needs now, while also working to secure change for the future.
Thank you. Muna, tell us about the stigma you see from your dual perspectives as a future healthcare professional and person with lived experience of the disease. In 2 minutes.
Yeah. So I have had some bad experience personally with doctors also gaslighting or doing things that shouldn't. It doesn't need to be like that. Even people who were supposed to be specialists in diseases like this, for example, fibromyalgia, and should be a little bit aware of allowing some time to explain symptoms and to express my worries. But I've also had, strangely, a situation where I had recently joined MIOJ as a member, and I had been a few months in my new degree when they had a new campaign with a poster that said fibromyalgia is invisible, but the pain is real. And I thought this was an amazing opportunity to be able to expand this to the whole of the Algarve, where I am studying, because we were all doing internships at the primary healthcare centers there. So the faculty was very welcoming. My colleagues also agreed to take the posters, but some of them told me that the doctors didn't want to put up the posters. And even one of the doctors said, if I put up that poster, all the women will say they have this disease. And I was like, how is this possible nowadays? And actually, from my experience during my internships, fibromyalgia is a lot more recognized than MEFS. So I have never seen anyone during my internships with a diagnosis. I don't really know anyone other than the people that I've met through MIOJ. But I do know of some people with fibromyalgia diagnosis. So we are here still. Things aren't clear, and there's probably a skew in the diagnosis. Also, doctors who are actually caring people, and those specific examples, have told me, oh, now we are going to have a patient, they're a little bit difficult, they have fibromyalgia. But then they're actually nice to the person. They allow them to talk, they are caring, but they still have this reaction. So we do still need to do a lot of work here in Portugal. And if this is the case for fibromyalgia, it's much worse for ME/CFS. Also, a teacher recently from neurology, which is supposed to be the area of expertise, has told me, oh, but those are diseases that are not very well known when I spoke about this conference. And I told him, well, ME/CFS has been long recognized by the World Health Organization, and then he completely changed his attitude. So.
Okay, thank you. Monica, what communication strategies have been most effective in changing public perceptions and dispelling myths about the disease? Short.
Like I said earlier, my work has been done very much in an unofficial basis. It's basically been done organically and using common sense, really, and emotional intelligence. Sometimes you get gaslighted. I was once seen by a doctor, and after I listed my symptoms, he said, "Wow, are you married?" And I looked at him, none of your business, because he said, "You must be a real pain in the neck." And I just thought, you know what? This is not right. You know, this cannot happen. And basically, on the other hand, I have the most incredible GP who said, "Monica, I don't know what your illness is, but you know what we'll do? We're going to treat you." At first she said palliatively, and I thought, God, well, I'm not quite there yet. And then she said symptomatically. I thought, okay, that's better. So she's wonderful. She's open. She knows that I take my research very seriously. She's open to my suggestions. So my suggestion is, when you go and see a doctor, gauge their receptivity, or a nurse, for instance. Gauge how receptive they are. Don't waste energy on people who are not prepared to listen to you. I had a nurse once at one of the worst relapses that I had say, "Oh, you should really take a stroll down to the garden down the road. And have you done that?" I said, "No, I am actually in the middle of a relapse, 15 months. She said, "Oh, you know what? With that attitude, it's going to be really difficult." And I thought, you know what? I'm not going to let you get away with it. So I said, "What do you know about my illness? Do you even know the name?" And she was accompanied by a doctor on a home visit. And she stopped. And she changed, her demeanor changed completely. So, don't let people get away with gaslighting, with mistreating you. We deserve respect. Doctors deserve respect. Doctors, this is not a well-known disease. And some of them I've been extremely lucky. It's very kind, very open. Take articles, take statistics, come armed with concise facts that can help them understand. And don't give up.
Okay, thank you. Cian, what advice would you have for someone wanting to start advocating in this area?
Someone newly wanting to start advocating in this area, I would say that there are many organizations across the world now who are predominantly run by people living with lived experience of this disease, either with the disease themselves or as carers, but also by willing allies and friends who see the injustice here and want to make a difference. So I'd say get in touch with your national organization and see what's possible there. But we've also heard that there are very varied ways of getting involved in this advocacy space. And what Monica has done through that kind of individual outreach to doctors has been really powerful here in Portugal. And I see the same in other places, in Czech Republic, in South Africa, in Mexico, and there's some brilliant advocates here from Brazil who are making real change there through kind of direct work with government policy advisors and more. So there is real opportunity here, and beyond that, get in touch with us at the World ME Alliance. But I think it's all about taking that first step, posting something on social media, creating connections, working together, collaborating, knowing that you are not alone in this story and that together we can and will make a difference.
Okay, thank you. And last question for all of you. Can you give one word that describes a value you want to see in advocacy going forward, in the advocacy of this illness? And, not one word, but 1 minute, okay? Muna.
Well, I think maybe I need this. I think we mainly need to bring awareness, especially here in our country, as we have, I think, all said, to the generic public, to patients, also that we can gather as patients, that we start shifting a bit also, was one thing that I wanted to say earlier and maybe make sense now, towards a more social model understanding of this also as a disability and not just in the medical perspective. And so I think that's my word, awareness.
Okay, thank you. Monica?
So I've gone over my 2 minutes, and now I'll go over my 1 word, 3 words: target, strategy, and communication. I think we need to define targets for guidelines, for diagnostic guidelines, for treatment, have a strategy in place, and communicate. There is so much information out there, and 32 years is just so much information that I would like to share with people, and there are so many things that people are not aware of. Forgive me to bring my own example back onto the table, but 15 months ago, I was bedridden. I could just about get up and cook. I had spasms. I thought I was coming down with some kind of neurodegenerative disease other than what I already had. And I was lucky enough to be part of an incredible support group. And I asked the question, does anyone have these symptoms? And the answer I got was, are you taking this medication? Which supposedly was harmless. But guess what? Not for me. I stopped, the spasms stopped, the fatigue stopped. Of course, I didn't go back to being Superwoman, but I went back to my normal baseline. Communication. And I cannot stress that enough.
Well, like Ed Young said about a friend of him, you can write a book. It's a service.
Would you do the preface?
Okay, I will do it. Yeah, I will do it. Okay. Cian.
I've been thinking about this question, and I'm not sure this is the right choice, but the word that comes to mind for me is acceleration. That I want us to see change faster, and I think that comes through collaboration. And maybe that's difficult when we work in a world full of people with ME who have an energy-limiting disease, but acceleration is what we need to see. So that's my hope for the future.
Thank you very much. And Sonya, please.
So Sean got there before me, so my word was accelerate, and I think it's really important that we accelerate research, we accelerate understanding, we accelerate just in all areas and service provision so that we can achieve equity. As I said right at the beginning, too many people are invisible, too many people are suffering, too many people are struggling in so many different ways, and I just think it's tragic and it's unacceptable. And certainly in countries like the UK, where we're not dealing with some of the issues, say in parts of Africa, that we should see improved services. And I think that can only happen by us all working together to work systemically, collaboratively, and I think that's when we'll eventually achieve equity.
Thank you. Well, I thank very much the four of you.